Hello everyone. Today's topic on discussion is cellulitis. So what do you mean by cellulitis? So here the word cellulitis, in this there is a term itis which means inflammation, and mainly inflammation is caused due to the infection. And the first term is cell, that means inflammation and infection of the cell. So this infection is mainly caused by the bacteria. So this bacteria affects the skin layer slowly and rapidly. They get penetrated into the skin surface and they get multiply and causes infection, and then inflammation can be easily seen due to the symptoms present. Then we'll see the definition. Cellulitis is a bacterial infection involving the inner layers of the skin. It specifically affects dermis and subcutaneous fat. So as I told, in this the bacteria are mainly involved and they deeply penetrate into the skin layers and slowly they causes infection into the dermis and subcutaneous fat. Then we'll see here in the diagram, you can see the layers of the skin where the minute skin layers are shown. So in this, whenever there is any cut or injury onto the upper layer, or you can say superficial layer of the skin, so due to that cuts, the bacteria get penetrated into the skin layers and then they cause infection into the dermis and subcutaneous fat. Then see on to the next slide. You can see here, due to the infection and inflammation, there will be redness formation on the skin that can shows the inflammation, and that is mainly called cellulitis. We'll see the etiological and risk factors. So in etiology, the main causes are Staphylococcus, Streptococcus group A and B, then H. influenzae, periorbital cellulitis. That means due to the H. influenza, mainly periorbital region will be involved, that is eye area. Then facial cellulitis in children below 3 years old. Then Streptococcus pneumoniae. So these are the causes that cause cellulitis in a person. Mainly these are group of bacteria. Then risk factors, which involves local trauma, example laceration, insect bites, wound, skin infections such as impetigo, scabies, etc. Underlying skin ulcers, fragile skin, immunocompromised host, diabetes mellitus, inflammation, example eczema, edema secondary to venous insufficiency or lymphedema. So due to these conditions, when there is a breakage in the skin or injury, or you can say there is infection due to another secondary condition, so with the help of these conditions, the bacteria get enter into the skin layer where they causes infection. Then we'll see the clinical manifestation, that means signs and symptoms you'll be noticing when the person gets cellulitis, when the person gets inflammation in the cells. So signs and symptoms are pain and tenderness in the affected area, redness or inflammation of your skin, a skin sore or rash that grows quickly, tight, glossy, swollen skin, a feeling of warmth in the affected area, an abscess with pus, fever. So these are the symptoms you will be mainly noticing. We all know whenever the person get infections, so fever is the first thing you will be noticing in the patient. Then slowly and since it is a skin area, so slowly you will be having pain, rashes, then edema and so on. Then we'll see the diagnostic procedures that can be carried out. So first we know history collection. So patient history, we will be trying to know about the past history, whether he undergone any injury or accident or any other infection or medical history. Then physical examination, we will try to find out the signs and symptoms like pain, tenderness, swelling. Then we'll go for the culture and sensitivity test. Swab any wound discharge for culture and sensitivity. If the patient is having any injury, so with the help of the swab, we'll try to take that culture and we'll send it to a culture and sensitivity test with which we can find out the type of bacteria present. Then we can go for the blood culture if the person is having systemic toxicity, if any other systems are involved, in the case like fever, chills, tachycardia. Then extensive skin or soft tissue involvement, if any other skin layers are involved which is very delicate. Then underlying Comorbidities like lymphedema, malignancy, neutropenia, immunodeficiency, splenectomy, diabetes. Then special exposures like animal bite, persistent cellulitis. So we can go for the blood cultures in these cases if the person has animal bite or undergone any other disease conditions like lymphedema, malignancies, neutropenia. So in that cases we can go for the blood culture. Then radiographic examinations can be done, like US ultrasonography can be done to know about the skin abscess. Then MRI can be done to know about osteomyelitis. Then CT scanning can be done to know the necrotizing fasciations, that means necrotizing of the cells, that means cell death. Then a skin biopsy if the disease is certain. If after doing these many tests you are not, or doctor is not able to get certified with the disease, then the doctor can advise the person to go for the skin biopsy, in which a small portion of the skin layer will be taken where there is infection and it will be sent for the test. Then cultures of swabs from intact skin are not useful. So intact skin means wherever there is no infection on the body, if you are sending that portion of the skin for tests, then there will be no particular result. That means you will not find any answer of that test. Then we can go for the management and interventions. What type of care you can take of the patients with the pharmacological and non-pharmacological interventions. So in that, the first is goals of treatment for mild cellulitis. The person has first stage of cellulitis, so what you're going to do? Goals of treatment for mild cellulitis are: resolve infection, identify formation of abscess, check tetanus prophylaxis. So if it is in the initial stage, mainly people don't identify the disease and so they don't care for them. So first and foremost, you have to resolve your infection. The person must try to treat the infection. Then if there is abscess formation, they should identify what kind of abscess it is, and then first they should check that whether the person is having tetanus prophylaxis or not. Then we can go for the medical management. In that, mild cases of cellulitis can be treated on an outpatient basis with oral antibiotic therapy with dicloxacerine and amoxicillin or cephalexin. So these antibiotics can be given if the person is having mild cellulitis, and it can be treated in the outpatient department. If the cellulitis is severe, the patient is hospitalized and treated with intravenous antibiotics for at least 7 to 14 days. So if it goes little severe, that is in the middle stage, so patient can be hospitalized and can be given intravenous antibiotics for 7 to 14 days, that is 1 to 2 weeks. Then immobilize the part and elevate the extremity above the level of heart. So in severe cases, we should advise the patient not to move here and there. We should restrict the mobility, and should raise the foot end of the patient above the heart level. Then provide moist heat to promote wound healing. So we should try to help the patient with the moist heat, that will help the wound to heal faster. Then patient with known community acquired MRSA or purulent cellulitis. MRSA means methicillin resistant Staphylococcus aureus. This MRSA condition is mainly caused due to the prolonged use of antibiotics. Antibiotics are the drugs that are mainly given to the patient when they are getting in contact with the bacterial disease condition. So due to the long take off or very long duration of intake of biotics, the body get used to of those drugs. So due to those drugs, there is a disease condition called MRSA, where the body identifies the drugs, and so after some time, after a long duration of those medicines, the body stops reacting towards it. So this MRSA, due to unknown community required MRSA, that means when the patient has taken a lot of antibiotics, now body is not responding to those medications, then we can go for the trimethoprim sulfomethazole 8 to 12 gram per kg per day for 7 days. Dosing is based on trimethoprim. So this trimethoprim sulfomethazole 8 to 12 gram is given according to the weight to that person if other antibiotics are not reacting to his body. Then we can go for the non-pharmacological management. apply warm or, if more comfortable, cool saline compress to affected areas for 15 minutes. So according to the patient's situation, if patient demands and if the patient is having uneasiness, so you can help the patient with the warm compressions. Then make border of arrhythmia with pen to monitor spread. So wherever there is a starting point, you can make it a border and you can notice the spread of those diseases, that how rapidly it is spreading in the body. Then elevate, rest and gently splint the affected limb. So as I told you before, you have to elevate the head end of the patient, foot end of the patient above the heart level. That will not allow the edema formation in the extremities. Then you can go for the pharmacological interventions. So in pain management, we'll be giving acetaminophen 10 to 15 gram per kg per day according to the patient's body weight. Then oral antibiotics if no known MRSA or non-purulent cellulitis. And the patient is not having MRSA. I have already told you MRSA is a condition where the body get resistant to antibiotics. If there is no MRSA, then you can give oral antibiotics to the patients like cefalexin, cloxacillin. These can be given to the patients. Then patient with penicillin allergy, erythromycin 40 mg per kg per day is given to the patient. Then patient with known community acquired MRSA for purulent cellulitis, trimethoprim, sulfametazole 8 to 12 gram is given. So these were the drug therapy or pharmacological interventions given to the patient in case of the cellulitis. Except than that, if the patient is pregnant or breastfeeding woman, then you can give cefalexin, cloxacillin, erythromycin and acetaminophen may be used as listed above. Then trimethoprim sulfamethoxazole is contradicted. So this one drug is contradicted and other drugs can be given. Then in this condition there are certain complications. These complications are blood infections, bone infections, inflammations of the lymph vessels, inflammation of the heart, meningitis, shock, tissue death. This condition looks very rare and very simple, but since there is long term, people don't get identified with the disease, so it can take a very severe case in a patient, and patient may go for the death. So it is very, very essential to take the treatment when the symptoms are getting started or it is on the first stage. So in today's class, we have seen about the cellulitis, that is inflammation and infection of the skin. Then we have seen the causes and risk factors. In that, the causes are Staphylococcus, Streptococcus, H. influenzae, then facial cellulitis, Streptococcus pneumonia. So these are the group of bacteria that cause cellulitis in a person. Then we have seen the risk factors, clinical manifestations, which mainly involves pain, tenderness, redness, tighty, glossy, swollen skin, fever, and so on. And we have seen the treatment for the patients, which mainly involves the both pharmacological and non-pharmacological management. So in non-pharmacological management, we have seen the rest to give patient complete bed rest. Then we have to elevate the foot end of the patient. Then we can also give warm compress to the patient for the comfortable to make him feel comfortable. Then in pharmacological management, mainly antibiotics will be given like acetaminophen, cefalexin, cloxacillin, erythromycin. These drugs are given to the patient to treat the causative agent. Then we have seen certain complications that can be very severe if the condition goes to the last stage. That can be blood infection, bone infection, inflammation of the lymph vessels, inflammation of the heart, meningitis, shock, tissue death. So that's all for the today's class. Thank you to all the students.